Parents always ask me what they can do to help their child's vision. In today's video, I want to talk to you about 4 terrible eye habits you need to stop your children from doing for them to have really good long-term eye health. Hi, I'm Dr. Nagori. I'm a board-certified ophthalmologist and a glaucoma specialist, and you're watching the EyeFacts.com channel. Remember, this video is for educational purposes only, and you should talk to your personal doctor for any personalized medical advice. So now let's get into our countdown. Habit number 4, eye rubbing. Eye rubbing is not good for children's eyes. It's actually not good for anybody's eyes. And I know it can be really tough in children to get them to stop eye rubbing because they don't really have self-control. So what you're gonna wanna do is just gently remind them by moving their hand away from their face. You can always encourage them to not rub their eyes, but one of the most important things that you need to do is figure out why they're rubbing their eyes. For my children specifically, they tend to have a lot of allergies that are associated with pollen and being outdoors. So I noticed that they rub their eyes more. So in order to control that, I have them on seasonal allergy medications, and we try to limit the allergen exposure when we can. But each treatment for each person is going to be different. So with the help of a doctor, you can figure out why your child is rubbing their eye and what are the best ways to discourage eye rubbing and get them to stop. So now, why is eye rubbing so bad? So eye rubbing can actually cause the cornea to change shape, and not just temporarily. It can actually change shape permanently. The cornea is the clear part of the eye that lies in the center of the eye, and when it changes shape, it can be associated or lead to a disease called keratoconus. Now, there is another video about keratoconus on this channel, which you can check out. If a patient develops keratoconus, they really may not be able to see clearly, even with the help of glasses and contacts. Habit number 3, too much time indoors. So a lot of patients wonder, why would too much time indoors hurt my eyes? Well, if you've seen another video on this channel related to time outdoors and myopia progression, then you already know that spending around 2 hours a day outdoors can help delay the onset of myopia in children. In a world where electronic devices are everywhere and screen time is pretty common, it can be really hard to achieve this 2 hour a day mark. You can try to achieve this for your child by making sure that whatever school they go to or daycare they attend, they have some time outdoors, and then give them some time outdoors before they go to school as well as after they come home. Now, this does not guarantee that they won't need glasses, but there is good evidence to show that at least 2 hours a day of outdoor time can delay the onset of myopia in children. Now let's get to habit number 2, which is prolonged screen time and using up-close screens. So near work or having objects very close to the face can actually increase rates of myopia. I know screen time is a common way to get your child to settle down if you need to get something done, or if you're in a restaurant and you just need to get through a meal, but it's really important that you push that screen away from their face and allow them to focus at a distance if possible. What you really want to avoid is allowing them to hold the device in their hand where they can really put it right up to their face. It's also important to try to implement screen breaks. There is a rule which you may have heard of called the 20-20-20 rule, which means that every 20 minutes, a person should look at something 20 feet away for about 20 seconds. If possible, in young children, you want to have screen breaks even more frequently and for longer. Now, apart from your eyes, we do know that screen time in the evening can disrupt circadian rhythm, so this is also a good reason to get them off their devices well before bedtime. And now the number one thing that I feel parents should really pay attention to when it comes to protecting their kids' eyes. This is skipping eye protection. Childhood ocular trauma is way more common than you think, and unfortunately, trauma to the eye in childhood can lead to lifelong vision problems for your child. If your child is playing a sport or an activity where their eye could be injured, you need to make sure that they're wearing eye protection. For children, most eye doctors will recommend that the lenses that they wear are shatterproof. Now, if your child already needs an eye prescription or a pair of glasses to see clearly, they may need a separate pair of protective eyewear that has their prescription built into the pair. Hope you found this helpful. For more tips on how to keep your eyes healthy, remember to like this video and subscribe to our channel. Thanks for watching, and we'll see you next time.